Okay, welcome everyone. I know Eugene, I believe, introduced Marianne Goodman, Business Development Director, and I'm Richard Oreghi, Head of Sales. We're going to focus today on the FF3 line, which is our newest line here at VIVANT. We're going to talk about FF3. Is a new line. It was the last thing Dr. Fulton was working on before he passed, which was to reinterpret the new type of vitamin A and the use of vitamin A with growth factors. We have two main products, and that is our bio-intensive and the triple repair, and I will go into them slowly in a second. So just again, I'm sure you're all aware of Dr. Fulton's accomplishments. I will just very quickly recap that. Dr. Fulton was one of truly the pioneers of dermatology in the United States, if not in the entire world. He was the co-developer of Retin-A, the developer of benzoyl peroxide gel, which we know as Panoxyl, and also topical erythromycin. And just so you know, a little bit of the history of our company, he, along with his wife, Sarah Fulton, Sarah was a known researcher and chemist of her own right. They founded VIVANT 33 years ago in 1990 in California. We are now in Miami, Florida. We've been here for about 20 years. And you're all familiar, hopefully, with the VIVANT line, which is wonderful for focusing on acne and hyperpigmentation. With that being said, then came FF3. FF3, and I'm going to jump into this here. The FF3 is really an incredible technology where Dr. Fulton was playing with our retinyl propionate, which is our patented vitamin A, with growth factors. Marianne, you wanted to?
Yes, I wanted to say that, so did you talk about GFP complex? GFP complex is the compounded ingredient that we use for these two amazing nighttime correctors, which would be the biointensive GF and triple repair complex that Richard was talking about, so the main ingredient there is the GFP complex, which is a combination of the retinyl propionate that he was talking about and growth factors together. And we use a combination of advanced peptides. In these formulations, we use pseudo-Alteramonas ferment extract, and manuka honey, as well as alpha hydroxy acids. And I'm using the website because it's more in depth, I would say, than the presentation. That's why I switched over. So these products are a combination of all these ingredients, because they're meant to mildly exfoliate without overly stripping the skin, but at the same time, plumping and hydrating the skin. So
there are the two main correctors in the FF3 line are the triple repair, which is this one over here, on to the left. And the triple repair has shown us incredible results, and particularly for what is sun damage, not melasma, but sun damage. The results you're seeing here are 60 days from this patient. So again, this is a combination of the retinyl propionate with the GFP. The differentiation between this and then the biointensive that we'll speak about in a second is, again, the formulation. The vitamin A in the triple repair, if you look at the ingredient deck, falls much higher up on the ingredient deck, so it's much richer in vitamin A because you want that skin cell renewal to take effect. Then we have the biointensive, and the biointensive is for what we call menopausal, perimenopausal skin. or estrogen depleted skin. The biointensive is then again as well a combination of vitamin A with growth factors with lactic, correct, Marianne?
Correct.
Yes. But here, the vitamin A is going to be lower in the ingredient deck because we cannot come in with that intensity.
Stripping
Intensity. Because what happens with menopausal skin, when you're looking at patients that are 45, 50, 55 plus, the skin is very delicate, very crepey. So you have to be very gentle in its exfoliation process. Marian, I don't know if you would like to add to biointensive and
yes,
how.
I would like to add that it won the New Beauty Award. That is a very prestigious, sorry, I'm sick. Prestigious beauty magazine in the US. So it won the New Beauty Award for best serum for menopausal skin. And the product does not contain any hormones or like any hormones. It's literally retinol propionate combined with the growth factors and the peptides and the acids, which are, like I said before, mildly exfoliating the skin and also promoting collagen production and plumping up the skin. Okay.
Marianne,
Now I'm gonna get into the Hydra Intensive HA. So the Hydra Intensive HA is the morning serum for the biointensive GF. Hydra Intensive HA is a combination of hyaluronic acid, peptides, and DMAE, and it is meant to plump the skin and make it look more hydrated in the morning while the skin is being mildly exfoliated at night with the biointensive GF.
Marianne, can you show the before and after of Jackie?
Yes.
So they can see it large. I know it's in this. There we go. Okay, so if you look here to your at the screen to the right, I don't know, point there. I don't know if you see my arrow going around or Marianne's that.
Yes,
So
we
this
can.
is 90 days on the protocol. So this, number one, this patient has never had any filler, has never had Botox, has had nothing, zero. She was on the protocol of biointensive at night and the Hydra Intensive HA in the morning, and this is 90 days. And now Marianne will speak about the protocol on
yes, so now I'll talk about the triple repair complex, which is the protocol for photodamage skin, which means sun damage and wrinkles. So I wasn't able to show you guys the biopeptide AHA because we do not have it on the website yet, and it is not on the presentation. It was launched about a month ago, I would say. Okay, so as Richard had mentioned, the person on the left side, which I'm pointing with the arrow here or circling with the arrow, this person was using triple repair complex, and the morning serum for triple repair complex would be this biopeptide AHA. I'm just saying this before I start with what is in the biopeptide AHA. Biopeptide AHA is a combination of 4% mandelic acid, hyaluronic acid, and peptides, and DMAE. And that is what we combine with the triple repair complex in a regimen to achieve these results. So just to reiterate, the FF3 line is much simpler than the regular VIVANT line. We have 2 products for photodamage, which is sun damage and wrinkles, and we have 2 products for menopausal skin. And again, because I like to just repeat, the 2 products to treat photodamage are triple repair complex at night and biopeptide AHA in the morning. And then for menopausal skin, patients would use biointensive GF at night and Hydra Intensive AHA in the morning. Okay, with this line, you do not use a toner. because it is packed with very powerful ingredients. And then the other important thing is that it can be combined with the more soft VIVANT cleansers like green tea cleanser, mandelic wash, cleansing milk, and buffing grains. Okay. And then finally, we have a product that can be used, that's part of the FF3 line, that can be used on both photodamage and estrogen depleted skin, which is a maintenance product for the home, Manuka Enzyme Lift. Manuka Enzyme Lift is a combination of pineapple enzymes and Manuka honey. And these enzymes will mildly exfoliate the skin to help it look brighter. It's kind of like a peel that doesn't peel that you can do at home. We also recommend to use Manuka Enzyme Lift while on the treatment 2 to 3 times a week, and it will maintain the results of professional treatments that you do in your practice. And that would be it for the FF3 line. Now, Eugene, we can do the questions. I see 2 questions here, or I'm sorry, not 2, several questions here, but in Russian or in Ukrainian. So I think Julia will
take care of this. Okay, the first question is, are there any counterindications for FF3 triple repair complex?
Just, it's not pregnancy safe because it has retinol propionate.
Does it suit for men over 45?
Yes.
Just a question about the triple repair.
Yes, triple repair complex is different than biointensive GF because it is more exfoliating, so it can be used on men and women, I would say 35 years and up. One more thing, Julia, for them to know. So triple repair complex and biointensive GF, even though they are acne safe, they are not for the treatment of acne. So if the person has acne, they will have to be using a VIVANT regimen.
Also, I would just like to add, Marianne can confirm, is when you are on the FF3 line, you should not be using any other actives, because the actives in FF3, both the biointensive and the triple repair, are very strong.
Yeah, so kind of like what I said with the toner, just no other serums but the ones we recommended before. Any other questions?
Yes, there's one more. Can those products be used for around orbital zone? I'm not quite familiar with this.
Yeah, so the orbital
around the eyes.
He's talking about around the eyes.
Okay.
You want to go around the orbital area. So just like you feel that bone there, you just go around it. We are coming up with an eye cream in the future.
Can we use the products while doing mesotherapy? During the course of mesotherapy?
Let me see what specific, because maybe mesotherapy is something that we have another name for here. Give me 1 second. 1 second.
Yeah, okay.
Well, according to what I'm hearing here, what I read here, mesotherapy is a French technique where you inject enzymes and vitamins into the skin. In that case, if you're using a different procedure where it involves actives, I would not recommend using it at the same time, but waiting maybe a week or 2 between mesotherapy and treatment. So they can prep with these products, but I would suspend them maybe a week before and then restart a week after.
Okay, the next question is, what is the percentage of retinol propionate in the serums?
So it is comparable to 0.25, right, Ricky?
0.025, like Dermagel.
0.025.
It's the same at the same level as Dermagel is.
Okay, what is the combination of FF3 with peeling products?
when you do chemical peels, you follow the same procedure as you do with regular VIVANT products, which is if you're doing a peel, one of our peels, you use it until the day of, and then you suspend it for a week while you do the aftercare.
Okay, so there is a question in English for you. Are the products recommended for people in their 30s?
Yes. They can be, but not the biointensive GF, because the biointensive GF will not provide enough exfoliation to see results. I'm going to say I am 32 years old and I used it for a few months and I didn't see much of a difference in my skin versus people that used it and they're like in their 50s, 60s, they saw a major difference. The one product that can be used, I would say, in combination with any VIVANT product is the Hydra Intensive HA from the line, and the Manuka Honey Hydra Intensive, because it doesn't have any actives. It just has hyaluronic acid and peptides. So it is like a RejuvaRx on steroids.
Okay, how long after a peel can you continue using the products?
So you said how long after they...
After a peel. Can you resume?
So 7 days after.
Do we need to be using SPF creams during the day?
Absolutely, always, forever.
Yes, the sun is not your friend.
Okay, what is the recommended term? How long can you use these products for? How long?
So like with the whole VIVANT line, when you commit to your skin, it's kind of like you're brushing your teeth every day. You're going to use these products until the day you die. There's nothing wrong with them. They're just cutting the skin cell renewal cycle and then plumping up your skin. So basically until you die.
So we're talking about the FF3, right? Despite the fact that it's so
the whole
active and
VIVANT,
intensive.
the whole VIVANT line, including the FF3. And I'm going to say, so skincare is a commitment. And like I was saying, skincare professionals are the dentists that are doing, let's say the dental cleaning once or twice a year. And then VIVANT is your toothpaste. That's how you want to see it. And I saw a question in English that says, can VIVANT retinoids be used while breastfeeding? The answer is no.
So the Manuka product, does it... do you apply it as a serum without using any cleaning product? Or do you use it as peeling and then you'd have to take it off?
So you would cleanse the skin first. Then you would apply the Manuka enzyme. Then rinse it off with water and then continue with your regimen.
Okay, maybe that's the good time to thank you, Richard and Marianne, for the presentation. Thank you, everyone who joined. Thank you for being active with your questions. And we will be happy to see you again at our Allure Beauty webinars.
Excuse me, but thank you, Yulia, for all your help, because my Russian is a little not perfect yet. But thank you so much for the translation and for assisting us in communicating to the team here. And Eugene, thank you. And we look forward to doing it again.
And thank you, Elena, too.
And Elena, and we're always here to answer all the questions.
Thank you very much. Thank you very much.
So we want to thank again everyone present. I want to thank for the assistants. And just another important point is that all of the people present at the webinar get a 10% discount for 3 days.
I see here that they're speaking in English. You're very welcome. We're always happy to answer all your questions. And we hope that now you have a clearer view of FF3. Okay.
Okay.
We're going to say goodbye now.
Okay, thank you. Let's stay in touch.
Okay.
Okay.
Bye-bye.
Yep. Bye-bye.